Every year in the U.S., millions of dollars are exchanged in the name of healthcare. It's a sector that represents almost one-fifth of the nation's economy, yet it leaves millions of Americans struggling to afford the care that they so desperately need. Widespread medical debt is a uniquely American problem. 100 million people in the U.S. currently have some kind of healthcare debt, which is more than 40% of American adults. We can see that this study by Papanicolas et al. Found that the proportion of the population with health insurance was 90% in the U.S., lower than the other countries, which ranged between 99 and 100%, and the U.S. had the highest proportion of private health insurance. We can already see that there's a clear disconnect in America. 90% of people have health insurance, but 40% of people have medical debt. So what's going on here? Let's take a look at health insurance. So when someone can't pay their medical bill, who is going to front it? Health insurance is essentially a third-party payer system where the patient doesn't have to pay the entire cost directly because the insurer pays a chunk of it. I'm going to introduce a few terms that should be helpful in your understanding of health insurance in America. A deductible is the amount a policyholder has to pay up front before their insurance plan kicks in. Early health insurance in the U.S. had generous reimbursements that hospitals took advantage of. This introduced the concept of fee-for-service. Every service that your doctor provides you with is billed individually. So of course, American doctors will want to provide you with more services because that means they will bring in more money. This is the concept of provider-induced demand. In this video, I will argue that America has one of the least effective healthcare systems in the developed world because the price of healthcare in the U.S. greatly exceeds every other developed country, yet our health metrics fall short. Here we are revisiting the study by Papanicolas et al. We can see that in 2016, the U.S. spent 17.8% of its GDP on healthcare, and spending in other countries ranged from 9.6 to 12.4%. An article by the Peter G. Foundation noted that in 2022, the U.S. spent an estimated $12,500 per person on healthcare. For comparison, Switzerland was the second highest spending country with about $8,000 in healthcare costs per capita, while the average for wealthy countries, excluding the United States, was only $6,400 per person. So clearly we can see that Americans spend a disproportionate amount on healthcare when compared to other developed countries, but how do our health outcomes fare? Well, let's take a look. The U.S. had the highest percentage of adults who were overweight or obese at 70.1%. The range for other countries was 24 to 63%. Life expectancy in the U.S. was the lowest of all the 11 countries at 78.8 years. And infant mortality was the highest. The U.S. did not differ substantially from the other countries in physician workforce or nursing workforce. It had comparable numbers of hospital beds, but higher utilization of MRIs and CAT scans when compared to other countries. So I hope you guys can notice that this is a pretty clear example of provider-induced demand, and I can recall several times where an MRI or CAT scan that I really needed had quite a hefty fee for the service. Administrative cost of care accounted for about 8% in the U.S., compared to a range of 1 to 3% in other countries. For pharmaceutical costs, spending per capita was $1,440 in the U.S. versus a range of $460 to $940 in other countries. Salaries of physicians and nurses were higher in the U.S. For example, generalist physician salaries were $218,000 in the U.S., compared with a range of $86,000 to $154,000 in the other countries examined. Here we can see how the conclusion of the Papanicolas et al. Study supports my argument. The United States spent approximately twice as much as other high-income countries on medical care, yet utilization rates in the United States were largely similar to those in other nations, with labor, goods, and administrative costs being the major drivers of price differences. So at this point, we've learned that Americans spend about twice as much as other developed nations on medical care, yet perform noticeably worse in health metrics like obesity, life expectancy, and infant mortality. We've also learned that over 100 million people in the U.S. currently have medical debt. Now I'm going to introduce a few more details to help demonstrate the full scale of American healthcare right now. Remember how we talked about the deductibles earlier? Adjusted for inflation, the cost of an average single-plan deductible has more than doubled since 2006, and the cost of medical care rises much faster than the average cost of all other goods and services. This figure is also adjusted for inflation, and it shows how the total healthcare expenditure is almost 7 times what it was in 1970. 7.4% of Americans are facing catastrophic healthcare bills, which is more than double the next closest country. Okay, so you may be asking yourself about public healthcare options for Americans. Medicaid is the nation's public health insurance program for people with low income. The program covers more than 1 in 5 Americans, and the highest annual income for one person to be eligible is $17,600 right now for Californians. So, does Medicaid work in decreasing medical debt? Obviously, it's always good to keep in mind that correlation does not equal causation, but I think this figure pretty much speaks for itself. Alright, so I could talk here all day and show you countless figures, graphs, and peer-reviewed studies about how us Americans are paying significantly more than the rest of the world for subpar healthcare. But why does this matter? Why was I compelled to make this specific video? Behind every statistic lies a human story. A son, a daughter, a husband, a wife. They're stories of families wrestling with impossible decisions, stories of doctors and nurses striving to provide the best possible care in the worst of situations. Obviously, the outrageous cost of healthcare in the U.S. is not a simple problem with a simple, clear-cut solution. It is a complex issue deeply woven into the fabric of our society, economy, and political sphere. But amidst these struggles, there are also stories of hope, stories of medical innovations, policy reforms, and grassroots campaigns that may carve the path for a more fair and equitable healthcare system. Change will not be easy, and it will not come quickly. Each of us have a role to play and a stake in the outcome. Thank you so much for joining me on this deep dive into American healthcare, and never forget to continue asking questions and seeking solutions.